Good morning, good afternoon, good evening, depending on where you're joining us from. Welcome to the Africa CDC regular press briefing. This platform is set up to provide critical updates on public health emergencies happening across the continent of Africa, and also highlighting Africa CDC's role in supporting member states to effectively respond to these health crises. Our usual host, Dr. Ahmed, Ogwell, Ouma, Acting Director of Africa CDC, is here today to provide recent updates and respond activities happening across the continent, and as well answer to the different questions you members of the media will have for today's section. In today's briefing, the director will provide updates on Africa CDC immediate steps taken to support the government of Tanzania in the wake of the Marburg viral disease outbreak that was declared this week, and as well continue support being provided to the government and people of Malawi in the aftermath of Tropical Storm Freddy, and of course the ongoing cholera outbreak in the country. So everything Africa CDC is doing in these two countries, and of course in other countries that are facing health crisis, will be highlighted in this briefing. Following the director's briefing, as usual, we are going to move into our question and answer section. And let me inform us that that session is only for journalists to give questions to the director based on the briefing and other issues that they may have to raise in this section. So without much ado, let me turn you over to our host. Director, it's over to you for your briefing. Thank you.
Thank you. Thank you very much, Nick. And good morning, good afternoon, good evening, depending on where you're joining us from today. First, let me begin by wishing all our Muslim sisters and brothers, wherever they may be, a very blessed and productive month of Ramadan, which begins today in most parts of the world. And we are looking forward really to a month that will have less in terms of health emergencies and disease threats on the continent. Today, let me start by sharing some data. From the beginning of 2023 to date, on the African continent, taking into consideration all the 55 Africa Union member states, as Africa implemented 43, that is 43 different public health events. In the span of 3 months, we have documented 43 different public health events. Of the 43, 19 are considered as serious, and this means that they have the potential of spreading beyond the area of the outbreak. And of these 19, we as Africa CDC are following very closely 8 of them. And of the 8, we have deployed to support in 4 of these public health events. So the figures are important: 43 in total, 19 being serious events, 8 that we are following up very closely, and 4 where we have actively engaged in response on the continent. Today, I would like to share details of 4 of those major public health events, and that is COVID, the Marburg virus disease outbreak in Tanzania, the most recent one, the ongoing Marburg virus disease outbreak in Equatorial Guinea, and the combined cholera outbreak across the continent, as well as the effects of Cyclone Freddy, particularly the Southern Africa region. So these are the 4 that we would like to look at in detail today. And let me start with COVID. as we normally do. To date, the cumulative number of cases is 12.2 million, which is 2% of the total global burden of COVID. Recoveries are still at 95%, meaning 95 of those who have been documented as having COVID have recovered. And unfortunately, we have lost just under 257,000 people, giving us a case fatality rate here on the continent of 2.1%, and the deaths on the continent are accounting for 4.1% of the deaths globally. When we look at the 1 week analysis and focusing on epidemiological week 11, that is the 13th to the 19th of March, and we compare that with epi week 10, we see that the total of new cases for COVID-19 on the continent that have been reported are 5,894, which gives us an over 300% increase when we compare with epi week 10. So epi week 11, an increase in numbers of over 300%. When we look at deaths, we have documented a total of 3 new deaths during the same period, which is a decrease by 50% when we compare with the previous week when we had documented 6 deaths. When you look at the 4-week analysis, and the 4-week analysis is important because due to the reducing acuteness of COVID, some of the data we receive a little bit later than weekly as we had previously been receiving. So when you look at the 4-week trend analysis, comparing the most recent 4 weeks with the earlier 4 weeks, then we see that on the continent, we have seen an overall average increase of 92% in the number of new cases. And we have seen an over 600 average increase in the number of new deaths. And as I said, because of data coming in late, for example, for the last 1 month, we've had some countries reporting data a little bit later, especially for deaths. And this makes the jump look a little bit big. But the essential message here is that over the last 4 weeks, the numbers are increasing, both for the newly diagnosed for COVID as well as those for death. So COVID is very much still here with us. When we look at vaccinations, to date, we have received 1.1 billion vaccine doses for COVID. And we have so far administered 1.05 billion, which is a 96% administration rate of the total available COVID-19 vaccines on the continent. For coverage, we are at 55% now of the target population. That is the population that is 12 years and above. And that means that we have so far vaccinated over 417 million people on the continent. At boosters, we increased the booster coverage now to 7.2% for those who are eligible. Of the number of countries, those that have already reached the 70% the mark stand at 14 member states on the continent, and we still work to try and get as many as possible to reach that particular stage. We have also seen that over the last 4-week period, when we compare with the previous 4-week period, we are seeing COVID-19 vaccination picking up again in many countries due to the support that we are providing of integrating COVID-19 vaccination into routine vaccination and immunization at country level. And of course, although mass campaigns are still very important and targeted campaigns are very effective, we are also integrating COVID-19 vaccination into the regular health system so that we can be able to make it available in the most easy way to members of the public and ensure that no one lacks whenever they need vaccines. Which brings me to our Saving Lives and Livelihoods program. You will recall that we had at the beginning of this particular program engaged 51 of our member states who had shown interest in being supported for the SLL program. And to date, we are actively supporting 22 of those member states who are interested. The latest is Burundi, whose implementation started last week. And we continue to work with the other countries so that we can go into integration of COVID-19 vaccines into the health system, particularly routine immunization and vaccination. Let's go now to Marburg virus disease outbreak in Tanzania, which is the latest large outbreak that we have documented since the last briefing. On the 21st of March, the Ministry of Health of the United Republic of Tanzania declared an outbreak of Marburg virus disease in Bukoba district, which is in the north western part of Tanzania, an area that is bordered by Uganda, Rwanda, and Burundi. So it's really an area that is active in terms of movement of people. As of that time, from that time, we have cumulatively confirmed 8 cases. And of these 8, 5 have died, including 1 health worker. And the rest, the 3, the remaining are actually undergoing treatment at designated treatment centers. This calls for us to pause and reflect on the sacrifices that our health workers continue to give as they work, because they're the true front line of any emerging and re-emerging disease. And we commensurate with the family and the people of Tanzania for loss of that particular health worker. And we continue to work with them to reduce exposure of health workers and to ensure that they have the training and the tools they need in attending and looking after members of the public within the health sector. As you know, Marburg virus disease presents with anything from fever, vomiting, bleeding from different parts of the body. In the case of Tanzania, because they have the capacity, and this is one of our success stories of equipping a national level laboratory, a public health laboratory, to be able to do this diagnosis quickly. So the samples were taken to the National Public Health Laboratory in Dar es Salaam. And although this was the first time that Tanzania is reporting a Marburg virus disease outbreak, they had the capacity to be able to do laboratory diagnosis. And quickly, the rest of the team swung into action to ensure that this particular outbreak is being contained. So there is rapid response teams that have been deployed. So far, a total of 161 contacts have been identified and are being monitored. Indeed, active case search and case management continues. Very active risk communication and community engagement also continues. And as Africa CDC, we've deployed a team of experts to support the government of Tanzania in the planning and execution of their response. We are also in touch with the neighboring countries of Burundi, Rwanda, and Uganda to ensure that the cross-border elements of risk are also addressed early. Indeed, we are in touch with the rest of Tanzania's neighbor within the Eastern Africa region to ensure that all possible measures are taken to enhance surveillance across the borders. The third is the Marburg virus disease outbreak in Equatorial Guinea. As you know, this outbreak was declared since the 13th, February 2023, when that one confirmed case in the northwestern part of Equatorial Guinea was confirmed by the Ministry of Health there. To date, we have cumulatively seen suspected cases now standing at about 28, and this one confirmed case. The deaths that have been reported, particularly in the initial stages of this particular outbreak, the samples have been tested, and the government is processing those results. We are looking forward to the government letting us know the results of those initial cases, not new cases, but the initial cases whose samples were being tested in a government-run laboratory within Equatorial Guinea. It's important to remind ourselves that the area that is affected is about 100 kilometers or so area radius. So it's a large